So let's first talk about the mesolimbic dopamine reward system. So this part of the central nervous system allows us to survive. This reward system is even seen in infants right after birth. So when a baby is born after having been entirely supported by the nutrients of their mother, the baby then first experiences anxiety that something is needed. An example, hunger, thirst, all of that, and then often cries out. So the baby's brain at this time is releasing a hormone called corticotropin releasing hormone factor, and this is often known as CRF. So CRF is a stress hormone that activates part of the amygdala that is realize that it is in a stressful situation. So once the baby is fed, dopamine, which is another neurotransmitter, tells the brain that it's been rewarded. So these dopamine neurotransmitters connect to the receptors in the brain that allows the brain to know that it is no longer in a stressful state. So the baby is happy once again. The process repeats itself later in the day. This reward system is with an individual from birth to death. So this mesolimbic dopamine reward system is activated anytime stress occurs. Common activities that release dopamine is eating, drinking, exercises, sex, etc. So mind-altering substances also significantly increases the dopamine within the brain. Studies have shown that dopamine can be compared based on the concentration. So we'll be looking at dopamine as 100% to be baseline, where you are actually happy. So 100%, so the CRF is then released to signal that if it goes below that 100%. So for comparison's sake, food and drink increases the dopamine release to approximately 150%, sex to about 200%, nicotine about 250%, cocaine approximately 350%, and then methamphetamines approximately 1,250%. Since the mesolimbic dopamine release system has been an evolutionary component of humans, the brain does not actually process these mind-altering substances as dangerous since they have not been around the evolutionary process just yet. So our brain instead believes that this dopamine increase is real and needed for survival. So many individuals' brains, so approximately 90%, can understand that these jumps of dopamine are not normal. However, 10% of the population's dopamine receptors can handle a significantly more amount of dopamine than the majority of the population, and this is that 10%. So the brain actually needs a neurotransmitter called gamma amino butyric acid. We'll call that GABA, much easier to say. So inhibits those signals in the brain that the brain is saying, dopamine feels great, like let's keep getting more. So however, in that 10% of the population, this inhibition with the GABA which is considered the braking system, is not working properly. So as quoted, and understanding addiction, no science, no stigma, addiction isn't any more of a moral failure than a faulty braking system. In fact, it is a faulty braking system. So once an individual starts using these mind-altering substances more and more until they are using continuously, the brain responds to this overstimulation of dopamine by decreasing the amount of dopamine receptors in the brain, specifically D2. Since these receptors have now decreased, the individual that had been addicted to a substance needs to actually start using more of that mind-altering substance to overcome the anxiety and discomfort from that CRF neurotransmitter that we discussed earlier. Since at this point, the brain believes that it needs this mind-altering substance, it also becomes a point where the brain of the individual with the substance use disorder no longer is looking for the euphoria from the substance, but are just trying to feel normal. Let's take a look at what it does to the prefrontal cortex of the brain. So the prefrontal cortex is in charge of two important aspects of life in general. So executive functions such as reasoning, planning, decision-making, critical thinking, problem solving, and then also your personality, such as sense of self-value, self-control, and motivation. So differences in these prefrontal cortex of the individual using a substance. So differences in the prefrontal cortex of an individual with a substance use disorder and an individual without can be actually seen on an MRI. So physical changes are actually made to the brain with a substance use disorder. So an individual with this disorder doesn't actually have a reasonably thinking brain, to which often leads to poor choices that is often seen with substance use disorders. An individual can understand that using or drinking is a bad choice, but their brain has been hijacked to say that this substance of choice is the most important thing to them in the world. So in neuroscience, in the neuroscience world, this is actually known as salience. So as quoted by Dr. Chuck Smith and Dr. Jason Hunt in Understanding Addiction, a person suffering with a substance use disorder has lost the ability to recognize the reasonable from the unreasonable, the rational from the irrational, and indeed the truth from the false. As you can see, addiction is a disease. So what is actually the definition of a disease? So a disease is a disorder in a living animal or plant that typically produces specific symptoms and impairs normal function, which is exactly what we see in the brain with an individual with a substance use disorder. So now let's talk about risk factors. Let's first talk about genetics. So studies have shown that an individual with a family history of substance use disorder has a 50% chance of also developing a substance use disorder. Age is another significant risk factor for substance use. Especially individuals that started using at a younger age are also more likely to develop one. The reasons behind this is the mesolimbic dopamine reward system is not fully mature until around age 23 or 24. Around mid-20s, the maturity of that mesolimbic dopamine system is now considered mature, and you are way less likely to develop a substance use disorder. So another important risk factor for developing a substance use disorder is adverse childhood experiences. Studies have shown an individual that experiences any adverse childhood experience, such as abuse, neglect, exposure to domestic violence, significantly increases the likelihood that an individual develops a substance use disorder. The CDC actually has developed a test that looks at the amount of ACEs, which is pretty much the acronym for adverse childhood experiences, and has found that the higher number of ACEs that an individual experienced is the higher chance of developing a substance use disorder, and as well as a higher chance of either attempting or committing suicide. Individuals with ACEs are more likely to develop a substance use disorder is because children that have experienced these forms of trauma often live in a constant state of stress, which is, as we have learned, that releases that stress hormone CRF. So in order to fix the constant stress level, oftentimes mind-altering substances are used to feel better. Having a psychiatric condition is also a risk factor for a substance use disorder, especially if not treated. 2 or more psychiatric conditions are at an even greater risk for substance use disorders. Higher tolerance is also a risk factor, since if an individual has a higher tolerance for example, alcohol, you are more susceptible to developing one because your brain is getting a significantly more amount of that substance, which also increases the amount of dopamine in your brain without the brain actually trying to stop you. So as quoted by Dr. Chuck Smith and Dr. Jason Hunt, in our society, high tolerance is praised, but in reality, it's a warning sign. The more risk factors an individual has, the more likely they could develop a substance use disorder.